This is a slide for knee flexion. I'm going to use either a rolling stool or I'll show you with a pillowcase or a towel. So I'm on a stool that rolls, and so I'm just going to slowly roll into a knee bend as far as you comfortably can. But if we're working on knee flexion after an injury or surgery, there might be a point where we push into a touch of discomfort, hold for a second or 5 or 10 seconds, and take a big exhale. That helps the body relax into it, and then we're going to come out of it, and then we're going to go back in. So we're using the chair to just help us get into knee flexion while the foot is on the ground. If you don't have a rolling stool, find a tile, sealed concrete, wood floor, and I'm then just going to slide this as far as I comfortably can, and then come back. If it's tight through here, pause there, take an exhale, and then come back. But we're trying to get into greater and greater degrees of knee flexion. Of course, check with your healthcare provider on if it's appropriate to push into discomfort or not. I typically like to work in a pain-free range, but there's some circumstances restoring motion after a surgery that we go into a 1 to 2, max 3 out of 10 discomfort. We try and exhale into it and get a little more motion, but not more than 2 or 3 out of 10 out of pain. Of course, check with your healthcare provider. So I can use pillowcase on the floor. I can use a rolling stool. Sometimes if you're using a rolling stool, you can also use your arms for a little assistance. So if you're hanging out at your desk. But I find frequency of exposure matters, meaning I want to do this a lot. So I try to get this in 3, 4, 5, 6 rounds of a minute or 2 throughout the day, because joints like variety and they like motion. And so we want to get exposure frequently to the bending of the knee if that's where we're restricted for one reason or another.